This is manual muscle testing for the abdominals. Instead of that, I'm here to show you 4 ways where you can actually assess your core. And it doesn't involve pushing on people, because really, how effective is that? Oftentimes, a lack of strength isn't the reason why people fail at these manual muscle tests. But if it's not strength, then what is it? Before we get started, if you haven't seen the first video as to why we're assessing the abdominal wall in the first place, click this video up here to watch part 1. In my first video, I discussed the importance of ensuring there's a good recruitment strategy through your abdominals before progressing into further training. It's this simple. You can't strengthen a muscle your brain can't connect to. Which leads us to our first assessment test, the abdominal drawn maneuver.
The first step is to get an idea of what the abdominal wall layers feel like. With gentle pressure, you can palpate through the external and internal oblique to reach the transversus abdominis. As you recruit the muscle with a drawn maneuver, you should feel a symmetrical contraction at the deepest level of the core. At your thumb or fingertips, you should feel a gentle increase in tone. A 10 to 15% contraction of the pelvic floor during the abdominal drawn maneuver should result in an automatic contraction of the middle fibers of transversus. For some people, this will not be enough to recruit the upper fibers of transversus, and a specific connect cue is necessary. To recruit the upper fibers, visualize a wire between the lower area of the rib cage, then visualize connecting the 2 points of the rib cage together. You want to feel a deep, gentle increase in tension and not an abdominal bulge. If you find it is more challenging to recruit one side of transversus, or that you cannot relax the internal and external oblique, there may be a lack of neural drive to the muscle, and restrictions in the body must be released first to improve the nerve signaling to the muscle. If this is the case, you would want to find and release whatever is driving the impairment, and then retry the motor control strategy. If the motor control improves after the releases, continue to the second test. If it doesn't, isolation training for the inner unit and home release techniques will be necessary prior to progression. Test 2. The active bent leg raise test and the active straight leg raise test. First, you want to think of nothing, then lift a leg one at a time. Try to assess if one leg is heavier or more awkward to lift. If one leg feels heavier, there may be suboptimal load transfer through the pelvis. Then, perform the abdominal drawn maneuver and assess if the control improves during the leg raise. You want to know if there is less shaking through the pelvis and if performing a drawn maneuver improves the task. Try to do a set of 10 reps, as suboptimal strategies will be more evident with a bit of fatigue. You want to observe if there are any substitution strategies. Some common ones are rotation at the pelvis or thorax, generalized abdominal bulging, breath holding, or widening or narrowing of the rib cage. As an option, you can add force closure by compressing the pelvis. If this improves the control strategy, you may need to spend a few days working on isolation training first prior to moving on to the active bent leg raise or active straight leg raise. Test 3. The head and neck curl up. Think of nothing and perform a head and neck curl up task. Then, recruit the inner unit and perform the task. Observe the difference in strategy between the two. This is a task that requires good load transfer through the superficial abdominal muscles, so it is not uncommon to observe substitution strategies such as abdominal bulging, rotation at the pelvis or thorax, a lack of active control throughout periods of the range, or an over-recruitment of the hip flexors. For an optimal head and neck curl-up movement, you want to see smooth, fluid motion with no substitution strategies to perform the exercise. It is not uncommon to observe shaking throughout the body, which indicates there is poor load transfer throughout the trunk and the pelvis. Usually, there is a certain range throughout the movement where this is noticeable. Test 4. A standing resisted rotation. The therapist will place their fingers on the spinal segments of the low back and have the patient resist into rotation. The therapist will note if there is an apparent shift in the lumbar spine during resisted load. This indicates decreased control in the abdomen when transferring load. On the side where there is more pronounced low back pain, it is not uncommon for the patient to feel weaker in this direction.
So the goal of the abdominal assessment is to find out exactly where you should focus your training. If you are having troubles recruiting the muscle in the first place, low load and isolation training will be critical. Conversely, there's no point focusing on those drawing in exercises if you're able to synergistically recruit your abdominals during the head and neck curl up or the resisted rotation tests. So now that you have an understanding of the core muscle assessment, the following is a series of progressions you can try when you're working on your core training.
Core training can be categorized into 3 stages. In stage 1, we wake up the muscles that are no longer part of the motor map strategy. This stage is all about connecting the brain to the muscle to retrain these pathways. For this stage, the goal is to do the abdominal drawn maneuver for 10 reps of 10-second holds for 3 sets, resting a minute in between sets. This starts in static positions. As mentioned, at this stage, you may have to release the dominant muscles that prevent good inner unit recruitment. Here is where some precise manual therapy can help. After releasing the muscular imbalances, it is common for the drawn maneuver to feel easier. However, the benefits of manual therapy are temporary and must always be followed up with training. Keep in mind that starting in supine may not be the best for everyone. For those with an overactive pelvic floor, it may be more beneficial to start in a 4-point kneeling position on elbows. Here, we use the abdominal viscera by the weight of gravity to offload the diaphragm and pelvic floor while performing the draw-in maneuver. Also, for the right person, utilizing breathwork can help with the recruitment strategy. For those who are very external oblique dominant, perform a lateral costal breath to lengthen and inhibit the external obliques, then perform the draw-in maneuver. This can be a useful temporary strategy to reintegrate the motor map while one works to lengthen the obliques as part of their training. Conversely, some people may respond better to using an exhale breath as a connect cue, where one will combine the draw-in during the exhalation phase of breathing. Whichever cue works to help recruit transversus will be the one to use for the 10 reps of 10-second holds. When we can reintegrate the motor map strategy to the inner unit, we move on to stage 2. Here, we build capacity and layer on superficial muscles as load is added. The idea is to maintain the drawn maneuver and maintain the static alignment while moving distal segments. Here are a few exercises that are appropriate for stage 2 training. You want to perform 3 sets of 10 to 12 reps, resting 1 minute in between sets. It is not uncommon for stage 1 and 2 training to take up to 4 to 6 weeks for those who need a lot of work with building the muscular endurance. It all depends on the individual's baseline, so progress to stage 3 is able. In stage 3, we build more muscular endurance. Here, we make the exercises more challenging for the nervous system by adding rectus abdominis or oblique recruitment, with progressions into multiplanar movements. Progression to stage 3 is highly dependent on the individual's baseline strength and control. For someone who has a good control strategy or is familiar with recruiting their inner unit, they may not need to focus on stage 1 and 2 training, and they can jump right into stage 3. However, for those who have either chronic low back pain or recurring history of acute low back pain, there is usually some lack of control that can be identified on any of the 4 assessment tests shown earlier. These are the kinds of people who would benefit from improving the timing of their core muscles, and progression to stage 3 may take 4 to 6 weeks of training prior to improving the recruitment strategy of the superficial muscles.
Now, something we have to keep in mind during all stages of core training is the concept of technical failure. Oftentimes, people will start to feel like they're not able to do more reps, not due to a lack of strength, but due to a lack of neuromuscular efficiency. This is the feeling where one starts to lose control after a certain number of reps, because a lot of other co-contractors, such as your low back, your hip flexors, anything around the region of the abdominals, start to do the job of what the core should be doing. This is often the case for people who can't achieve that good delayed onset muscle soreness a day or 2 after their workouts, and they wonder why they're not getting stronger. It's important to recognize the threshold for technical failure and to know when exactly it's time to change the exercise to allow for more of an optimal control strategy. If you feel like there's a lack of control or an asymmetrical recruitment during your core workouts, I would generally recommend to try the exercises in the video and then reflect upon which exercises work well for me and which ones don't work so well. What you may start to recognize is that there's no secret exercise that promises to eliminate your low back pain or create this bulletproof synchronous core, because quite simply, everybody has a different baseline for their capacity. People with a really chronic history of low back pain or pelvic girdle pain, they may need to start at stage 1, and then people who are a little bit more trained, they may need to start at stage 2 or stage 3. Now, we've talked a lot about the importance of training your abdominals synergistically. However, there's often one overlooked area when we're looking at the core. Sometimes, the weak link to the pelvis and the abdomen can be found in this one extensively researched muscle that works to synergistically co-contract during abdominal loading tasks. To find out more, click this video up here to find out how the deep muscles in your low back can impact your abdominal recruitment strategy. And if understood correctly, it'll allow you to train smarter and achieve your rehab goals faster. It could just be the missing link to your core workouts.